Well, here's what we did. We enrolled over a 9-month period of time 50 patients that had liposuction of the abdomen and thighs. And additional, among these 50, 20 also had minor areas of liposuction. We were very strict about identifying which patients we wanted to follow in the study. All the patients had surgery in an outpatient accredited facility. They had surgery under general anesthesia, and they stayed 23 hours in the facility. The mean age was 32, with a range of 17 to 39. The mean weight was 159, with a range of 138 to 170 pounds. And we chose this specific target patient group because we wanted to be consistent in having them wear the same kind of garment. They would be able to fit into a large garment in this weight range of 135 to 170 pounds, with a rib circumference between 32 and 36 inches, a waist between 30 and 33. And you can see the numbers here. And we asked them to wear these full body girdles continuously for 4 weeks. Now, each patient received 2 garments, and they weren't told which garments they were being given, so it was completely blind on their part. The experimental garment, which we referred to as the ComfortWeave fabric garment, was in black color, and the control was the standard Design Veronique PowerNet fabric garment in beige. And here's what they look like. Very similar design. We had the patients change the garments every 24 hours for 4 weeks. And we filled a study register and got informed consent from each patient. Before and after photographs were taken as is standard for our practice. And we had post-operative visits on the usual manner, and telephone interviews were also conducted. Critical in this study was a 35-item questionnaire that the patients were asked to fill out. As I said, our practice provided the control garments, and the Marena Group provided the experimental garments. These are the kinds of questions that we asked the patients. They number 35 total, and we asked them to basically circle a range of experiences from strongly agreeing with the statement to strongly disagreeing. And we categorized these questions into various groups. We had a group of questions under garment feel. For example, this garment felt soft. This garment stretched adequately. This garment supported me. This garment held me firmly. And we purposefully built in redundancy into the questions to make sure that the responses were consistent. We also asked questions about comfort and healing, such as the garment cooled my skin. The garment was easy to put on. The garment was easy to take off. And care and aesthetics of the garment, such as the garment resisted staining, the garment cleaned easily, the garment smelled fresh. And then we asked them to give us an overall rating and to select between the two, if given the choice. And here are the results that we obtained. And 94% of the responses were 100% consistent across all the questions, so there was a high degree of accuracy. The 3 most important factors that patients selected were comfort, support, and softness. They specifically noted that the control garment was more irritating, more itchy, and more harsh against the skin compared to the experimental garment. And the results were that more than 8 out of 10 patients prefer the experimental garment or the ComfortWeave fabric garment over the PowerNet fabric garment. They felt that it was softer, more conforming to their body, and more comfortable and easy to wear over that 4-week period of time. The experimental garment did very well on multiple levels of assessment. It was better, hands down, in softness, as experienced by the patients. It gave better support and comfort after multiple washings, which is very important. And it was as good or better than the control garment on in multiple areas, including better than the control garment at keeping the patient cool, better at ease of getting in and out of it, and reducing pain and itching. But the experimental garment did not do poorly in any category and was as good as the control in reducing swelling and keeping the patient dry and improving bruising. And after a statistical analysis, we confirmed that the experimental garment did prove to be softer, as you can see here, with a p-value on this graph of 0.0017. And in the questions around support, although the experimental garment was not superior statistically, the trend was toward that. So our conclusion was that there was a significant increase in patient satisfaction and compliance when given the choice between the ComfortWeave fabric garment and the standard garment. And we found that there was a significant difference in comfort as experienced by the patients after liposuction. Thank you very much.